My name is Britten Burkhouse, and I work for the Alaska Division of Public Health as their CFO.
And I am Amy Ferris. I work for the Washington State Department of Health as the CFO. I actually I have contracts and procurement that falls under my purview. I have grants, accounting, our central budget office, fiscal monitoring, those payroll, those functions. But I also have contracts and procurement. I do not have HR, and I believe you do. And so HR is actually a separate office than financial services here in Washington State. The hiring process, we play a role in the fiscal support, looking at those new hires up front and making sure that we've got the resources and the funding to actually make that hire happen. And then we look at the back end when we're looking at the budget codes to make sure for accuracy for the person that we have coming in. So that's kind of our role here in Washington, or my role here in Washington State.
Okay. Well, mine's really easy. My primary role is liaison between the division and other divisions and departments for the state. I typically resolve issues that involve those things that you just mentioned, procurement, grants, facility leasing, human resources, payroll, and recruitment. I do have a lot of other things to do. I basically maintain financial accountability while enforcing internal accounting and accounting policies, admin policies, regulations. We recently went through a QI process for our FFRs and our federal reporting. And we involved all stakeholders and developed a swim lane documenting our internal FFR process. We've seen some really great outcomes on this, and we are really excited to keep the momentum going.
So are you part of the organization's kind of executive team or agency leadership team?
We call ours the executive leadership team. Each section chief is a member of the executive leadership team as well. They're just kind of outside of the director's office. So we include them, and we get feedback from them and kind of see where they're going with their programs, any kind of hiccups they have, programmatically speaking, any kind of issues that they might have. So hot topics.
So we have an executive team that makes up our Secretary of Health, our Chief of Staff, our medical officer, health officer, our policy director, communications director, and then we have a special assistant as well around health systems transformation. And so they make up our executive team, and then we have what's called an agency leadership team. So that's those of us like our assistant secretaries over our programmatic divisions, as well as myself, our chief information officer, our HR director. Those folks, we make up that agency leadership team. So we do meet regularly together and kind of coordinate and give input, but I just see that it's critical to have those relationships and connections with both those sets of leaders in an organization as a CFO. So for our state, our programs actually do the bill analysis. So they're reviewing all the bills to see what the impact is to our work. And then the fiscal notes come to the financial area for us to do the financial portion. And fiscal notes are very succinct, and you're just talking about the fiscal impact that this bill will create for our organization.
I actually coordinate with our other sections or divisions, and I reach out to our subject matter experts, and they prepare the bill analysis. They send it to our director's office, and then we review it, and then I look at it and pretty much prepare my fiscal impact analysis off of that.
One of the biggest pieces that I would share is having a strong team. I, as a CFO, could not do this without my team. So having those folks that support me in doing this work and kind of monitoring our finances for the agency, communicating, training folks on the rules and regs that we have is very critical. The other piece is internal controls. So as I think about, for our agency right now, we've really connected our accounting and grant director with our enterprise risk manager, as well as our kind of internal auditor that helps to liaison between our state auditor's office and with feds and others that come in and audit us. Having that connection so that they're helping us to think about where's our risk in the agency so that we can build those processes, tools, internal controls in place to kind of help manage that is also very critical. As a public health agency, our funding is so diverse. I haven't worked for many other state agencies, but in my partnership with other CFOs in Washington State, in other organizations, I've come to realize that public health, we have limited resources and we take them wherever we can get them. One of the things we had started in Washington State is this work around foundational public health services, which is looking at what are those core services as a public health, governmental public health system we need to provide because no one else will. Plus those capability functions. I think that's the hardest part to fund is your communication support, your financial resources, your HR resources, the back-end services are, not their thing that folks are like, yay, we want, to do more communication. They want to get into the direct services. Mm-hmm. And I think that's a challenge in public health because we need those capabilities behind us in order for us to provide the services that we provide.
Mm-hmm. I think something that they may not realize that we do is that we actually are the glue that keeps everything going, right? Mm-hmm. I mean, I'm sure they think they know what that means, but I think we've done a great job today on describing on what our job and what our roles are. Mm-hmm. And maybe they'll learn something about what we do.
Yeah. And thinking proactively and strategically is one of those big things. Mm-hmm. Because with funding, we need to be thinking about where's that money going to come from? Where's those opportunities going to come from as we're doing our work and not just wait for something to come because that doesn't always happen. Rarely happens. Right. In public health. So really thinking strategically and proactively.